Welcome. This module is intended for managers of the Antiretroviral Treatment and Access to Services Program, ARTAS. This is the first of 4 self-paced mini-modules and focuses on the elements of ARTAS and its readiness for implementation. It lasts approximately 30 minutes and want to remind you that this event does not replace a formal ARTAS training. If you would like to participate in a formal training, we will provide you with the links at the end of this session for you to request it and to access the pre-course module. We also want to highlight that this presentation is the result of a collaborative effort of 4 capacity building assistance providers, members of the CIBA Provider Network. That is, B.A. Laris from ETR Associates, myself, Armand Lors with JSI Research and Training Institute, Melanie Graham from the New York Department of Health, and Sarah Jane Brath from Proceed. By this point in the process, we have designed this series to support you and other supervisors and managers who oversee programs that are implementing ARTAS as part of their CDC-funded initiatives for high-impact HIV prevention. This is a 3-part series that includes first, a live webinar in which you and other ARTAS managers participated that provides an overview of all of the key information you need to know to support your ARTAS staff. Second, a series of 4 self-paced mini-modules to provide more detailed information on key components necessary to support the successful implementation of ARTAS, this module being one of them. And third, a live technical assistance session where you have access to a panel of skilled capacity building providers to answer questions and help troubleshoot any issues or concerns. During this presentation, we want to encourage you to take notes, as well as to type the questions you might have on the pod that appears on the right side of your screen. These will be recorded, and we will address your questions during the live technical assistance session. As a manager, you're probably wondering what your role is with ARTAS. We like to think this in a few stages that involve the getting started stage. That is the information you need to consider when becoming familiar with ARTAS and deciding when to implement the strategy. The pre-implementation stage refers to your agency making any necessary changes and planning for the necessary human and monetary resources, building relationships with community partners, creating a marketing plan, and developing monitor and evaluation plan. The actual implementation stage, which involves issues that your agency staff will focus on while implementing ARTAS, and the maintenance stage, that is integrating ARTAS into your existing services, continuously working to adapt, monitor, and evaluate the strategy, as well as to making any necessary changes. This is laid out in great detail in the ARTAS implementation manual. We recommend for you to become familiar with it. It will be available for you to download it at the end of this module. As we mentioned, there are lots of details in the ARTAS implementation guide, but today we're going to highlight a few key ideas that we think are the most helpful for you and other managers in the early stage or the getting started phase of ARTAS.
Text objectives.
Today we'll cover the capacity and readiness for ARTAS, and after you complete this module, you will reinforce your understanding of the goal of the program. You will also strengthen your knowledge around the ARTAS core elements, and you will fortify your ability to identify ways to get your agency ready to implement ARTAS. Let's begin.
So we'll start with the goal of ARTAS. The goal of ARTAS is to assist persons who have been recently diagnosed with HIV getting linked into care for the first time. ARTAS can also help persons living with HIV entering care after a prolonged absence. ARTAS is a multi-session approach that focuses on the needs of each client individually. It is important for you in your role as manager to understand the goal of the approach as well as its process and structure in order to be able to effectively support linkage coordinators in their efforts.
ARTAS has four core elements that provide the main foundation and structure for a successful linkage into care. ARTAS strives for building an effective relationship between the linkage coordinator and each client. It also empowers and motivates clients by focusing on their strengths, which includes conducting a strengths-based assessment and encouraging clients to identify their own strengths, abilities and skills that will support their effective linkage to medical care and accomplishments of their goals. ARTAS also fosters ownership of efforts and successes by facilitating the ability of clients to accomplish their own goals. This involves helping them identify and pursue specific goals and developing a step-by-step plan with them by using the ARTAS session plan. Lastly, ARTAS addresses the needs of the beneficiaries by maintaining a client-driven approach. That means conducting 1 to 5 structured sessions with each client, conducting active community-based case management by meeting each client in their environment whenever possible, coordinating and linking clients to available formal and informal community resources based on their needs, and advocating on behalf of each client to linkage into care and other services as needed. Understanding the relevancy of each one of these core elements helps managers like yourself identify ways in which you could support your linkage coordinators in all of their efforts to implement ARTAS with fidelity.
ARTAS agency capacity.
And at this point, you have probably already decided that ARTAS makes sense for your organization. And there are several things for you to consider as you get ready to implement the strategy. Thinking about both your existing agency capacity and your agency readiness factors will help you know how much planning and problem solving and program development will be needed to be successful. And to help you think about existing agency capacity, we are going to specifically touch on the experience your agency must have providing case management, the strong relationships with community partners needed in place, your agency's technological capacity, and staffing. So let us provide you more detail on each one of these capacities.
So first of all, thinking about case management experience. When it comes to case management experience, it is important to state that the successful implementation of ARTAS will be achieved best by an agency with experience providing case management services or by contracting with an agency with a strong case management capacity. Not only will agencies with this capacity already have the existing structures in place that are necessary to implement ARTAS, such as case staffing supervision, experienced staff, related policies on confidentiality and boundaries, but these agencies will also have existing relationships with aid service organizations, or ASOs, community-based organizations, or CBOs, who are providing HIV services, and other delivery organizations. If these structures are already in place, they will reduce the amount of time you need for program startup and assist you in the creation of referral networks.
When it comes to community partners, it's beneficial to have a pre-existing relationships with key community partners before implementing ARTAS to reduce the time and effort needed for the program startup. If a community partner has an existing and strong relationship with your agency, then the community partner will likely be more receptive to learning about and participating in the strategy. In addition, where networks are already established, ARTAS can simply be folded into the existing system for referrals and to get clients into ARTAS strategy and link them to medical care and other needed services.
Regarding technological capacity, your organization should have the technological capability to maintain data collection and management systems for monitoring and evaluation purposes, particularly if the funding agency requires evaluation activities. In addition, your staff should be proficient in the use of common computer software. The funding agency may have specific requirements, but software to consider includes Microsoft Excel, Microsoft Access, and/or SPSS.
Staffing.
Depending on the size of your organization, your program, your funding amount, number of clients, or any other different factors, you'll have to decide on the composition of your ARTAS team. And to help you think about this, let us share some staffing guidelines you want to consider when deciding to implement the strategy. But note that these are not full-time ARTAS positions. Now, with the program director and our manager, as you know, is responsible for the overall implementation and management of ARTAS. This person must have experience with program management, including budgeting, staffing, marketing, and reporting. You may also serve as the evaluator as long as you have evaluation experience. Now, the evaluator designs and executes the monitoring and evaluation plan and oversees monitoring-related activities, including data collection, developing instruments, and reporting results. Data entry may be included in the evaluator's role or performed by the linkage coordinator. The evaluator position may be filled by an agency staff person or a consultant, but note that this position may or may not be required by the funding agency. Now, regardless, conducting ARTAS monitoring activities benefits the implementation of the strategy and your organization. The linkage coordinator supervisor. They oversee and provide direct supervision to the linkage coordinator, including case staffing meetings. Ideally, this person should have strong clinical skills, experience with case management, supervising case managers, and also being familiar with the program management principles. The linkage coordinator is the only full-time position and is responsible for the actual implementation of the strategy, meeting with clients, attending the first medical appointment, etc. This person is typically responsible for marketing the strategy to the community partners and performing data collection and entry activities. He or she should have experience providing case management services, and due to the intensive nature of ARTAS, the linkage coordinator's caseload should be between 25 and 30 clients at any given time. If the health department is implementing ARTAS, additional positions may be required. For example, if the health department is the grantee, but the strategy will be conducted by a CBO or ASO, then the health department will likely require a contract manager. The contract manager may or may not be the program director or manager, depending on the design and implementation of the plan.
Now, there are several actions that you can perform that could benefit your organizations getting ready to implement, to monitor, and evaluate ARTAS, such as conducting an ARTAS implementation situational analysis, and you might know this as a SWOT analysis. Also identifying potential challenges and possible solutions, involving management and other staff that might directly or indirectly interact with your clients, developing memorandums of agreement with community partners, and nurturing a close professional relationship with medical provider staff. These actions could help you and other ARTAS managers feel prepared and be supportive to their linkage coordinators. So let us provide more detail on what these actions entail. For the situational analysis, and as a manager, it is important to identify the strengths, weaknesses, opportunities, and threats of your organization that could be beneficial or detrimental to the effective linkage to care of clients through ARTAS. This action will help everyone involved recognize other services your organization provides that could leverage the efforts of clients to link into care. Some examples of threats could include limited funding, inexperienced linkage coordinators, and other programs already in place targeting the same population, like disease intervention specialists and or partner services. Some weaknesses could be that the organization is not a testing site and don't get access to newly diagnosed individuals promptly, or there is poor communication between the testing coordinator and case management. Some strengths may be that the organization already has a testing site, a food bank, and a case management and other services in place, and the internal collaboration is impeccable. And some opportunities could be integrating transportation services into ARTAS, developing a plan of communication between HIV testing team, case management, and medical appointments, to mention a few. So when you conduct a situational analysis, it could be helpful to distinguish areas of improvement and opportunities to initiate or to fortify coordinated efforts across programs. So in order to help you assess the readiness of your organization, there are some tools available for you, like the Agency Readiness Checklist. So take a look at this sample portion of the checklist on your screen to identify how this tool could help you conduct an ARTAS-specific SWOT analysis. Specifically, the checklist helps you consider essential questions related to case management readiness, HIV and AIDS readiness, agency readiness, and community readiness. This useful tool will be available for you to download at the end of this module, and it is also available in your implementation manual. So we strongly recommend that you take a look at the tools provided in the implementation manual to ensure your organization is ready to implement ARTAS. Even if you are further in the implementation process, they could still some ideas for enhancement. And remember that you could request technical assistance at any time in the ARTAS implementation process to support your efforts.
Barriers and solutions.
So another activity that could help you feel prepared and supported is identifying potential barriers and possible solutions. It is important to review potential challenges to the successful implementation of ARTAS. While your organization may not be able to eliminate all potential obstacles, being aware of them will allow you to plan accordingly. 3 common barriers often experienced by organizations implementing ARTAS are that the linkage coordinator is assigned to non-ARTAS tasks, that there are low referral rates, and that there is a lack of buy-in from external case managers and other partners.
The implementation manual discusses several potential barriers and solutions. We recommend for you to take a look at this section. But here are a few potential solutions to the 3 most common barriers we mentioned. The problem when a linkage coordinator is assigned to non-ARTAS tasks is that it does not allow him or her adequate time to effectively complete ARTAS-related activities. A solution is dedicating the linkage coordinator's time solely to ARTAS. Small caseloads allow the linkage coordinator to provide individualized, intensive services to each client. This includes, but is not limited to, following up with clients, completing paperwork, attending sessions and appointments outside of the organization, and cultivating and maintaining effective relationships with clients and community partners. Another solution is reviewing the linkage coordinator's roles and responsibilities, helping them prioritize tasks, balancing their caseload, and checking in with them regularly. The person responsible to ensure this happens is you, the program director or program manager, with input from the linkage coordinator supervisor. And remember, we will spend more time addressing staffing issues on Module 3.
The second common barrier that we mentioned and that we have seen is low referral rates. The problem is that it may take some time for the testing sites to adjust to the new referral system. Passive referrals may continue because staff members are not accustomed to the ARTAS referral protocol. A solution to this is to develop and sign a memorandum of agreement with each community partner that spells out any logistical processes that are involved in the agreed-upon referral process. Another solution could be to keep in regular contact with the referral sites to maintain effective working relationships with the community partners, update them on the progress being made, and remind them about the referral process. The person responsible for these efforts is typically the linkage coordinator.
And the third common barrier we know of is the lack of buy-in from external case managers or other partners. The problem is that the community partners may feel threatened that they first learn about ARTAS. They may see that the strategy is a competition and think that it will take away clients from their services. A solution is to early on explain the short-term intensive nature of ARTAS. Clarify how ARTAS complements other case management and consulting services provided within the community. Explain that ARTAS has the sole goal of linking clients into care. Clients can come to Ryan White long-term case management already linked to care, so these case managers can focus on clients' other needs such as housing, nutrition assistance, and employment. Another solution is to arrange for the linkage coordinator to complete all required documents and enrollment forms for all clients before transferring them into the long-term Ryan White case management. A different solution could be to use job title linkage coordinator as opposed to linkage case manager to avoid confusion with long-term Ryan White case managers. The person responsible to ensure this takes place is the program director, you the program manager, or the linkage coordinator.
Another activity that could help you feel prepared and also supportive is ensuring management involvement. You hold a great deal of vision and as the manager are key to assist with the successful implementation of ARTAS. When you and other managers are involved from the beginning, you can ensure linkage coordinators receive supervision that provides strength-based approaches not only with them, but with the organization as well. In addition, you can make possible that other support staff receive the proper knowledge and training necessary to implement ARTAS, such as the front desk staff, HIV testing coordinators, other case managers, etc. And it is crucial that in your role as manager, you assess linkage coordinators have manageable caseloads. And you can also provide a great deal of support for the linkage coordinators by coaching them on their roles and their responsibilities.
So another activity that could help you feel prepared and supportive is ensuring your organization has community partners. Remember that ARTAS helps clients achieve linkage to care and other necessary services that your organization might not provide, such as mental health, substance use, domestic violence, etc. In many cases, these services are a stepping stone for clients to move forward towards linkage to care. Therefore, it is in their best interest of your organization to develop relationships with other systems that offer those additional services for your clients. Many organizations already have formal or informal agreements to refer clients to each other. Make sure you develop memorandums of agreement that formalize your proactive interest to actively help clients receive all of the services they need. And in addition to having this document, be sure to enhance the communication between your organization and other organizations. Promote collaboration, learn about their services, and identify ways to work together as necessary. Learn key staff names, roles, responsibilities, and clientele's needs. Make sure your organization coordinates the referral proactively. Learn the different HIV services available in your area and lead the efforts to minimize duplication of services with DIS, partner services, case management, and others serving the same population. And equally important, develop MOAs to ease and ensure clients' linkage to their needed services. Remember that collaborating with community partners is a best practice to ensure clients meet their needs and that funds are spent wisely.
On your screen, you can see a section of the Stakeholders Buy-in Worksheet. This is another tool that will be available to download at the end of this module, and it also is available in your implementation manual. The Stakeholders Buy-in Worksheet is a very useful tool to help you conduct an artist-specific community partners assessment. You can use this activity as a guide to consider which other organizations to reach out to within the community and how to engage them in the implementation of ARTAS. Since implementing ARTAS varies slightly by setting, health department versus CBO, other two different worksheets are provided in the implementation manual. Whichever works best for your organization should be used. The worksheets contain a list of suggested activities and a column for the staff to record pertinent information related to the stakeholders. Specifically, the worksheet helps you consider essential questions related to identifying key stakeholders, involving stakeholders, and obtaining buy-in. As Armand mentioned earlier, you can request technical assistance at any time, especially when you are getting ready to implement ARTAS to ensure your efforts are on target.
And another activity that could help you feel prepared and supportive is ensuring a well-established relationship with medical providers. Because ARTAS' primary goal is to link a client with their medical provider, it is crucial for your ARTAS staff to have developed a strong relationship with the medical providers to whom you will be referring your clients. It is imperative for linkage coordinators to familiarize themselves with the test. Not only the HIV standard and confirmatory, but the battery of tests that might be required during the medical visits and the protocols around the tests. Linkage coordinators benefit the most when they also familiarize themselves with the medical intake procedures and forms. In fact, medical providers prefer clients who come prepared to their first visit. When linkage coordinators prepare their clients for the first visit, they will expedite the development of a great professional relationship. Linkage coordinators must develop a professional relationship with a medical provider that eases clients during their first visit. If the linkage coordinators you will manage are new to the position, set an appointment to introduce them to the medical providers your organization works with or will be working with. Linkage coordinators must maintain regular communication with medical staff. This regular communication will be evident and infuse trust in the medical staff, making the transition smooth and positive. Even if a linkage coordinator is unable to escort the client to the doctor, linkage coordinators should be able to know the front desk staff, the nurses, and the provider to describe them and infuse confidence in their clients. You as a manager could benefit greatly when you maintain continuous communication with medical providers as well. You could learn crucial information that could benefit the work of the linkage coordinators you oversee, and you could enhance your ARTAS team efforts.
Key takeaways.
Remember, ARTAS is successful when clients develop a plan to a healthy living with HIV and when the linkage coordinators assist them in the process. You can contribute to the successful implementation of the ARTAS approach by providing a supportive environment for your ARTAS team, your organization, and your community partners. That includes, but is not limited to, some key takeaways from this mini-module, such as assessing your agency's capacity and readiness to support proactive planning, developing and nurturing external relationships that will allow for an easy linkage to care process, and creating an administrative framework that supports a linkage coordinator's ability to provide for the client's needs. We have described the core elements of ARTAS, and now you have the basic information on how you can contribute as a manager to the readiness for your organization to implement ARTAS. We truly hope this presentation sparkled some questions related to this and that you were able to type them on the questions pod. Please take some time to type any additional questions that you might have at this moment and wait until the end for this session to download the files we made available for you on the files pod.
To help you gain more knowledge on how you and other managers can receive more detailed information on key components necessary to support this successful implementation of ARTAS, we invite you to participate on the second mini-module in this series. There we will provide more detailed information focused on ARTAS integration and relationship building. If you would like to access the second mini-module now, click on the link provided in the pod to the right of your screen titled Links. We look forward to your participation. To receive CEUs, please click on CEU Documentation Pod to answer 2 questions. Thank you.
Next mini module available, ARTAS integration and relationship building.